Hello again everybody, Jeremy Latham, the hip surgeon here. Today I'm going to talk about hip injections. I'm going to show you an injection into the hip joint itself. This is part of my top tips for hip series. Hip injections are done for several reasons. For this indication I'm doing it in someone who's got minimal changes on their x-ray but lots of pain from their hip. So I want to be certain that the pain is coming from their hip joint as part of this diagnostic pathway of seeing whether or not a hip replacement is the right thing for that person. If the pain is switched off by the injection, then we can be certain that the pain is coming from the hip joint and that patient's probably got arthritis. We also do injections around the hip joint into tender areas such as trochanteric bursitis, which is a bursa, a fluid-filled sac at the top of the thigh bone, a bit like tennis elbow. That's a different procedure and that can be done by your GP often or physiotherapists. This particular injection, I always do it in the operating theatre under sterile conditions. We use an x-ray machine to make sure the needle's in the right place. I'll talk you through it in this short video to follow. Thanks for watching. If you've got any questions or comments, please get in touch. I'm Jeremy Latham, I'm the hip surgeon. Before I do the injection, I identify the correct anatomical landmarks to help get the needle in the right place. We have an x-ray machine in theatre which helps me to do this. I draw some lines on the side of the thigh to make sure I know where I am. I prepared the skin using an alcohol-based solution of chlorhexidine. This makes sure that all the bugs on the skin surface have been eradicated. I'm doing this injection under local anaesthetic. Sometimes we do it under a general anaesthetic, especially if patients don't like needles. I draw up the compounds I'm going to put into the joint. The first thing that I inject is local anaesthetic into the skin. This numbs the skin surface so the patient doesn't feel the needle going in when I do the hip injection. It's really important that the needle goes into the joint itself, not the soft tissues around it. I use the x-ray machine and a small amount of contrast which is injected into the joint. This shows me where the needle tip is before I put the drugs into the hip joint itself. The needle needs a bit of a shove to get it into the hip joint, but once it's there, I then inject the local anaesthetic and steroid. This takes only a matter of seconds, and as you can see, the patient is quite unperturbed by the whole episode. The whole thing only takes a few minutes. The patient then goes back to their room, has something to eat and goes home. This patient was actually completely pain-free when I reviewed him 10 or 15 minutes after the injection. Well, I hope you found that helpful. Hip injection can be a very useful tool, particularly in patients where we're uncertain about the diagnosis. If you've got any questions or comments, or you'd like me to cover anything else in these top tips for hips series, please let me know. The details will follow after this. Thanks again for watching. I'm Jeremy Latham. I'm the hip surgeon.